Hello. Good afternoon. I hope you can all hear me. Hello.
Good afternoon.
Hello,
Yeah,
good
good afternoon.
afternoon.
Can you hear me please?
Yes, we
Yes, we
can
can
hear you.
hear you.
Okay, very good. I think it's 4-6, so we can start our meeting. So my name is Benjamin from Hoffman Laboratories. So Hoffman Laboratories are in charge of our supplement for the pregnancy, that's Vivagest. So without wasting my time, I'd like to invite the speaker for today's presentation. So the speaker is a midwife, a renowned midwife in Kumasi. He's with the Hope Exchange Medical Center based in Kumasi. And he's going to take us through today's presentation. So without waiting much, I'd like to invite the speaker to take over. Thank you very much. Maybe you can now take over.
Okay. Hello, everyone.
Kindly share your screen. We'll be very happy. Your presentation.
Sure. Let me share my screen. Please, I'm coming. Okay. Please, can you all see?
Yes. Yes.
Okay.
Just
So,
a little bit small. I don't know whether you are doing it from your phone.
okay.
On your phone, right?
Yeah. Is it that smaller?
Okay, so you just present. The most important thing is for us to hear you and understand you. So yeah, so just present.
Okay, sure. So, as Mr. Benjamin said earlier, my name is Mabel, and I'm a midwife at Hope Exchange Medical Center. Yeah. Today I'll be presenting on complications in pregnancy. And then by the end of this session, I hope that we'll be able to explain what pregnancy is, its divisions, complications, types, danger signs in pregnancy, and then the risk factors and how we can prevent these complications. Okay. So we begin. Pregnancy is the state of being pregnant, as we all know. And there's a time from conception to birth during which a developing fetus grows inside the uterus of a woman. And then there are three divisions in pregnancy. So we know that pregnancy lasts up to 9 months, right? Normal pregnancy. And when it's a C6, we assume there is a problem somewhere. So in that 9 months, it has been divided into three. We have the first trimester, we have the second trimester, and then we have the third trimester. So the first trimester is from month 1 to month 3, and then the second trimester from month 3 to month 6, and then the third trimester from month 6 to month 9. So with the first trimester, our body undergoes many changes. I mean, being a single person and now having a fetus inside you, there's definitely going to be some changes. So before the complication in pregnancy, I would like us to know what a normal pregnancy looks like, so that if there is any deviation, we can spot it out and then attend to it. So with first trimester, we will notice that there is fatigue, extreme fatigue. You notice that you get tired very, very easily. And this because there are hormones like progesterone and then estrogen at work. And then these hormones cause your blood level to go up. And hence the reason for being tired. Like if you lift something up a little, you get tired, then you have not done anything, but you feel exhausted. It doesn't mean that there is something wrong somewhere, or then it's a complication itself. It is because your body is undergoing changes, and hence the reason for that. And next is nausea and vomiting. Okay. So what happens is that during pregnancy, there's a placenta formation. And then this placenta, there is a hormone called the HCG. And then when this hormone is being released, it causes women to throw up a lot. So you realize that during pregnancy, you see women carrying, is it pail or something, a container, so that they will be able to either spit inside or, because it's not like they are forcing it. It's just that they can't control it, right? But then with the nausea and vomiting, when it's uncontrollably, you find yourself vomiting a lot, then we can suggest that it could be a condition called hyperemesis gravidarum, which we talked about. And then the next one is breast tenderness. Yeah. So as you are developing a baby, your tissues, your ligaments, tendons, they are all growing too. So your breast needs to prepare for milk. So there are milk ducts, and then it increases. And then the reason for breast tenderness.
Where is this one?
Now it's free.
Watch this program. Why? It's a live program they are doing. Hello. We can't hear you. I don't know whether there's a problem. Mabel, can you unmute yourself, please?
Oh, okay. I'm sorry. Okay. Is it better now?
Yes. Can you continue?
All right. So, I was talking about the breast tenderness, where your breast becomes sensitive, and then it gets swollen up, and then you're assuming something wrong with me. Am I okay? And I was saying that because getting a baby inside you, there's definitely going to be enlargement in your tissues, your ligaments and muscles and all that. So with your breast, there is a milk duct, and then this milk duct needs to prepare itself for lactation. I mean, after birth, you would have to give your baby breast milk, and hence the need for that. Yeah. And then with the frequent urination, so as your baby is growing, your tummy becomes bigger, as we all know, and hence it puts pressure on your bladder. So you find yourself going to the washroom a lot. Yeah. And then you find yourself drinking a lot of water. With the second trimester, which is, like I said earlier, from month 3 to month 6. And then when it's being calculated in weeks, it's week 13 to week 28. What happens is that you see that there's stretch marks all over. In medical term, we call it striae gravidarum. You realize that there's this stretch marks all over. It's not painful, just that you see stretch marks, and then you see a darker line, which is called linea nigra. I think I wrote it somewhere. Yeah, from your belly button to your pubic hairline. All these signs, when there is a linea nigra, it doesn't call for any attention, or it's not harmful, right? So it is just your body responding to new surge of hormones. So with the line, there is a hormone called melanin, and then this melanin has a way of being, it produces more, and hence the line. And even if you notice, there will be darker nipple at your nipple area called the areola. You'll see that place has become more darker. Yeah. And then we will look at the numbness and tingling of hands. Okay, so during pregnancy, we find ourselves we stand, our positioning and our posture changes. Yeah. So we find ourselves either standing and then leaning beside the wall. Hello. Yeah, please, I'm sorry. Like I was saying, leaning beside the wall and all that. And as you do that, you realize that the blood flow in your hands reduces, and then the need for the tingling sensation. So it's not a complication. Like I said earlier, I'm listing the things that goes on in normal pregnancy so that we would know when it's abnormal. All right. So we will look at the danger signs in pregnancy. These danger signs, when you see it, there is a need for you to pay attention to it and then report to your healthcare provider. You look at the first one, which is vaginal bleeding. So during pregnancy, we don't expect you to be seeing blood because you are not menstruating, right? So if there is any blood, that means we can trace it that there might be something wrong and hence causing that blood flow. So the first, it could be a miscarriage. Yeah. If you have any vaginal bleeding and then the first thing that should come to mind that maybe there is a miscarriage somewhere, and then you need to act faster and then go to your healthcare provider. So with vaginal bleeding, it shouldn't be when you see any bleeding from your vagina, that means there is a complication at hand. So these danger signs are like this. The same way if you have an abdominal pain and then you attend to the hospital and then you present to them that you're having abdominal pain, we don't diagnose you as you have abdominal pain. The abdominal pain might be tracing to a particular disease, like maybe peptic ulcer or gastritis. Yeah, that's the same way these danger signs happen. So if you see vaginal examination, that means it's pointing to something, a complication at hand. So it could be a complication like placenta previa. There is a condition called placenta previa. What happens is that when your placenta is being formed, we expect it to lie at the fundus, where the one closer to your chest. So you see your belly, and then when you get pregnant, it bumps out. The space closer to your chest, that's where your placenta should be lying. If there is any case and then your placenta finds itself at either close to the cervix or covering the cervix, that means there is a danger, right? And then this vaginal bleeding will help us trace that you may have placenta previa. Or there's another condition called placenta abruptio. What happens with that one is that your placenta is lying at the fundus where it's supposed to lie, but then it's detaching. So when there is a detachment, there is going to be a blood flow. Yeah. And then we all know what the placenta does for the baby. If whatever the mother eats, the baby gets it. So if the placenta is detaching, that means the baby is going to go into hypoxia. The baby is not going to have oxygen enough. The baby nutrients will not flow to the baby and all that, so it could harm the baby. So we would need to, and even with the mother, you can go into shock. So if you see any bleeding, please don't stay at home or don't. There is a need to call for attention and then go to the hospital. We will look at severe nausea and vomiting. So like I said earlier, for the nausea and vomiting, during your early stages, it's normal because HCG is doing its work. But when there is severe vomiting, you're always vomiting and then you can't even put anything in your mouth, you keep throwing up, there is a condition called hyperemesis gravidarum. And then with this condition, you will keep vomiting till you become hydrated. And then if you are dehydrated, you will not have any water whatsoever. And then the baby is also going to lose it. So anytime there is excessive vomiting, you would need to report to your facility. And then the next one is a feel of flood of water rushing down your legs. Okay. So whenever a woman goes into labor, the amniotic fluid, which is the water surrounding the babies, it breaks. We do not. Please, can you hear me? I think I'm getting feedbacks.
Yes, I can hear you.
Okay, sure. Whenever we do not expect you to go into labor before your due dates, right? So if you see anything like liquid passing down, sometimes you may even assume it's urine. But if you visit the washroom, you will see that even after urination, like there is still water coming out. Yeah, that could be that there is flow of your amniotic fluid is coming out, and then if it's coming out and then it's not time for labor, that means your baby will be losing oxygen and then nutrients, a whole lot of stuff. It's not yet time for him to come out, yet you are losing lipo, which is the amniotic fluid. So it's also a danger sign. The third one is abdominal pain. Okay. So with abdominal pain, we know that during pregnancy there could be fetal kicks and all that, and then that could come as a discomfort to most of us. But we don't expect it to be severe. If you see any, like if you feel any pain that is uncontrollably, and then you know that this one, as compared to the other pain, this one is not maybe a fetal kicks or it's not a contraction. That means there is something at hand, and then you need to pay attention to it. It could be that you are having even infections. We know that as pregnant women, we do discharge a lot, and then this discharge could bacteria have a way of going there and then causing infections. So it could be a sign of infection. It could be a sign of even early contractions. So if you realize that there is any severe abdominal pain, you will need to visit the hospital. The next one is unusual vaginal discharge. It could be that, so what, okay, let me give a physiological background. So whenever a baby is being formed, God has a way of putting a plug at the cervix so that there will be no ascending infection going up and then any descending infection. So what the plug does is that it prevents any infection from going up. If you find yourself having any vaginal discharge, it could be that plug at the cervix is being taken off, it's being brought out. A very unusual vaginal discharge that you've not seen before. It's normally slimy and then brown in color. When this happens, you should know that there is something definitely wrong. Okay. And then decreased level of baby activity or movement. What happens is that you should be able to feel your baby whenever you wake up, even throughout the day. You should be able to feel your baby. I know sometimes it brings discomfort and all that, but you should be able to feel your baby. And there is a research that says that in like 2 to 3 hours, you should be able to feel like 10 counts, right? And then 10 or more counts, okay? And then it shouldn't be lower than that. If you've woken up and you've not heard from your baby, you've not had any, you've not heard from your baby, like you know how it feels, you know that it's moving, right? You wake up and then you've not heard from your baby from morning to night, you should be worried. It could be a sign of uterine death. It could be that the baby is not responding. It could be that there's a sign of uterine, or even it could also be that the baby is in distress, right? So there is a need for you to visit the hospital. Yeah. So, like I said earlier, danger signs are signs. It has a way of leading us to the main cause. What is causing that sign, right? So if you have headache, we could trace it that, oh, maybe you have something with something wrong with your brain that is causing the headache. So we are now moving on to the complications of pregnancy. Okay. So with the complications of pregnancy, it can affect either the mother, the baby, or both of them. And then these complications, sometimes it comes before. So there are some people, they already have their medical conditions, right? Some people have hypertension already, and then when they get pregnant, the pregnancy also comes with its own complication, then adds up to their pregnancy. So there are three types of complications of pregnancy. So there are the maternal complications, the fetal complications, and also the pregnancy complications, which means it is the pregnancy that brings it. We have, if you're not pregnant, you're not going to get that condition. Example is ectopic, right? If you're not pregnant, you cannot get ectopic pregnancy. So we will look at the some of the complications during pregnancy. So we have gestational diabetes. Okay. So with diabetes, what happens is that there is accumulation of blood, there is accumulation of glucose in your blood, and this is as a result of insulin resistance. During pregnancy, you could develop that condition. So it could that you don't have that condition at all, but because of pregnancy, you could develop it, and then after pregnancy, it could go back to its normal stage if you manage it properly. Okay, so risk factors includes overweight, and then history of family history. If you know of anyone that in your family that has had gestational diabetes, or you could also be it could also be that you are having, is a risk factor for you to also have it. Yeah. And then okay. And then hello. I think I lost you for a moment. Please, can you all hear me?
Yes, can hear you. So
Okay.
can I continue?
Okay, sure. Okay. So with the symptoms of gestational diabetes, we have increased thirst and hunger. So we know that when you are pregnant, you are going to drink a lot of water. Yeah, because you are drinking for two. I mean, you're going to take a lot of water. But with gestational diabetes, what happens is that it's going to be frequent. You just finish taking water, and then you feel like taking water. Then you feel like you are always taking water, and then because you are taking more water, you're going to produce a lot of urine. And then another very key factor that when you see it, it could be a sign of gestational diabetes, is that when you urinate, you find ants around it. So because there is sugar in your blood, you find ants around it. That's a very key one. If you see that one, that means that like there is actually something wrong, right? Because someone could ask a question that, oh, we are in Hamatan, and then I could take a lot of water. So does that mean that I have gestational diabetes? That's why I'm saying that when you drink more water, you're going to produce more urine as usual. But here's the case that when you urinate, even at night, and then those that you urinate in pills and all that, when you wake up, you realize that there are some insects around it. And the most times it's ants. Yeah. If you see anything like that, there is a need for you to pay attention to it. And then there's also fatigue, blurred vision, and then slow healing of cuts or wounds. Yeah. I don't know if you've ever heard of diabetic wound. Whenever anyone has diabetes and then the person gets any cut, it is very difficult to treat it. You realize that you have been treating a wound and then it's not healing, right? That means that there could be a factor. And then I say this again. These symptoms doesn't mean that, oh, if you've observed one symptom like the increase in tests, that means, oh, I have diabetes, and then no. You realize that there will be other signs that's also backing it up. Yeah. So with complications, what happens is that for complications, we have for the mother and then for the baby. What diabetes does is that it can affect both the mother and then both the baby. There is a risk of developing high blood pressure or preeclampsia. Preeclampsia is a condition in pregnancy that we really, really do pay attention to, because it's one of the most common cause of maternal morbidity and then mortality. What it does is that you have high blood pressure Yeah, and most times this is why we would need to take our antenatal visits very, like, we should go regularly. Sometimes we think, oh, when we go, we just check our BPs. They will just tell you to go and urinate and then bring it, and you're asking yourself, they be sorry for the chief, then why am I always urinating inside the container? And then the reason why you are doing that is we would like to know if you are not developing a condition called preeclampsia. What preeclampsia does is that it could shoot your blood pressure. So normal blood pressure ranges from 120 to 90. That's the systolic and the diastolic I'm talking about. With preeclampsia, you could even go over like 200. And then there is a need for us to know that there is something wrong. And then with your urine, whenever we take your urine, we do check for something like protein and then glucose, right? If there is glucose in your urine, it could be a sign of diabetes, like we said earlier. If there is protein, it could be a sign of preeclampsia, and then the need for us to treat it. So whatever you are being asked or told to do at the maternity, don't see it as a normal routine. You just go, then you just urinate, and then you are getting bored of this. No, like, it's for your own good, and then for the benefit of you and your baby. Yeah. And then with the baby, what happens with diabetes? What happens is that they develop big babies. Yeah, the babies become very, very big, which is a term called macrosomia. And then most times they are not able to deliver vaginally through spontaneous vaginal delivery. So most of them, we do CS for them so that both the baby and the mother will be fine. And then, so management of gestational diabetes, blood glucose monitoring, health, diet, regular exercise, medication. With the blood glucose monitoring, so I don't know if you've realized it, whenever you come to the hospital, we do prick your thumb, and then we do take blood sample of it. Yeah, we do check for your sugar level, whether we want to know if it's within the normal range. And sometimes they ask you, have you eaten? If you have eaten, please be honest. Just tell them you've eaten. If you lie that you have not eaten, we have two types of checking for blood glucose monitoring. We have fasting blood sugar, and then we have random blood sugar. If you've not eaten, we go for the fasting so that we know that you are within range. If you are eating, there's another range for you so that we know that you are. If you've eaten and you say you have not eaten, and then we check and then it's low, we will assume that there's something wrong with you. Meanwhile, you have eaten. You get it? So please, whenever we visit the hospital, let's be honest. Okay, so our next one is hypertensive disorders in pregnancy. And then I've made mention of preeclampsia earlier on. So with the preeclampsia, if it's not treated properly, it escalates to eclampsia. And then with the eclampsia, there is convulsion. You realize that you even go into shock. There is convulsion. That's the difference between the preeclampsia and then the eclampsia. Yeah. And then there is pregnancy-induced hypertension. With that one, we won't see any protein in your urine, right? But then your BP will be high, which is your blood pressure. It will be high. With the eclampsia, you are going to see protein. With the preeclampsia, you are going to see protein in your urine. But with the eclampsia, you will see protein. Your BP will be high, and then you go into convulsion. You realize that you are convulsing. Like, what can I say? For those that don't understand English, I'm sorry, but then they say can, like, you be convulsing, like. So the complications associated with hypertensive disorders can be placenta abruption. I don't know if you've realized, but this is the second or third time I'm speaking about placenta abruption. What hypertension does, it could cause your placenta to tear off. That's how dangerous it is. So, like I said earlier, your placenta is supposed to lie at the fundal part. With placenta abruption, you realize that your placenta is coming out like white. So with hypertension, if you have hypertension already and then you get pregnant, you should pay much more attention to it. If in the pregnancy you get pregnancy-induced hypertension, you should also pay more attention to whenever there is a case of hypertensive disorder. Please do not joke with it, because it will cause a lot of complication to both you and then your baby. So in managing hypertension cases, most times there is bed rest. You advise you not to go outside, like rest, because one thing about blood pressure is that even when you come to the facility and then you've walked for a very long time, you could see that your pressure has shoot up. So sometimes when you come, they'll ask you to wait for a while, and then after checking, you realize that when you compare both of them, this one has gone down. So you need to rest. And then you'll be given medications. Please take them. I know that it comes with a whole lot of things, like you have to take folic acid, like your routine medications that will help your baby prevent neural tube defects and all that. And then they are saying that there is hypertension, so you have to take those drugs too. So you are going to forego that one and take your routine. No, you have to also include them, because the goal is that we want to achieve a healthy baby and then a healthy mother. Yeah. We will move on to low amniotic fluid. And there's a term called oligohydramnios, sorry. What happens is that we know that the baby swims in like in a pool of water. But in this case, there is little water surrounding the baby. You would realize that the baby is not flowing like through. So, and with this one, you can only see it when you visit your antenatal care regularly and all that, and then through scans and all that. So we would need to take our antenatal and then going for antenatal clinics very, very serious. And then when we go, I'm sure we do educate us on these things so that we will know what to do. I mean, if not for we thank God for Vivagest and then the webinar series they are doing for us. There are even some people that they do go, and then the pregnancy school, they are not being told all this. I'm sure right now someone now knows that this urine that the person has been taking in the container, it's because we want to check for glucose and then protein, so that we will know either you are having preeclampsia or not. Yeah. So there is a need for you to go to antenatal clinics and attend webinars like this. Yeah, it helps. Okay. And then with prevention, because the condition says that the amniotic fluid surrounding your baby is small, you would need to hydrate. As a pregnant woman, you will need to take a lot of water, because you are drinking for yourself and then for your baby. And then your baby needs amniotic, like not excessive, but then quite an amount of amniotic to be able to flow freely. And then this reminds me, with the amniotic fluid, what happens is that sometimes you go to the hospital and then you are being said, your baby is in a breech position. So we know that babies come with their head, right? But here's the case that you are being told that your baby is coming with the buttocks or the leg, and then you are being scared or you don't know what to do. Low amniotic fluid could cause that. You could go to the hospital and then you are being told maybe in your first or second trimester that the baby is coming with the buttocks. And then in the third trimester, you go back again and they say, now is the head. And you are saying, oh, praise God. God has done it. So I'll go and give testimony. Most times it's your hydration. If you take a lot of water, your baby will be moving. Like your baby moves anytime your baby is moving. So if you take a lot of water, your baby will be able to move freely. Probably the week that you went to the antenatal care, your baby had moved and then it was the buttocks presenting. And then you were being told that there is no need for you to be scared, right? You'll be asked to do some Kegel exercises and all that, and then drink enough water, because your baby will continue to move. And then when it gets to your time of delivery or your EDD, which is your expected date of delivery, you realize that it is the head that is the presenting part. So let us drink enough water. Water helps, especially in pregnancy. So we will move to urinary tract infections. So with pregnancy, like I said earlier, because you are producing a lot of discharge. When you're not pregnant, you produce discharge, as we all know. But then with pregnancy, the discharges becomes like more. And then if you don't practice good hygiene, there is a platform, or it serves as a wavelength for bacteria to be producing a lot. Yeah. So there is a need for you to practice proper hygiene when you are pregnant. That's not the time, like they say, pregnancy is not a disease. I know all the symptoms I've mentioned, like there are also symptoms for other diseases, but pregnancy is not a disease. If you are pregnant, you would need to look good. You need to smell good. I know that it's a lot, and then you are trying, but then you need to try harder. Like don't practice poor personal hygiene because you are pregnant, because it can affect your baby and then yourself. You need to make sure you are taking enough water. Yeah, the water comes in again. Pregnant woman, sorry, you and water, you're like friends. You're like two best friends. You should be taking water like a lot, because not only does it helps with regulation of amniotic fluid, it also helps with the clearing of infections. If you are drinking a lot of water and then you have infections, it can clear them through urine, then it comes out. So there is a need for us to take a lot of water. And then when we do not treat infections, we are trying to avoid it, right? But then if we do not avoid it and then we get it, and then in getting it, we don't treat it, it could result into preterm labor. Your baby is not up to term, but then infections can cause your contractions to begin or go into preterm. So you realize some people, they are not even up to date, but then they deliver, and then the baby has to be sent to the neonatal intensive care unit for it to grow, and then the baby will be in incubator and all that. We are trying to avoid all of these, and then by doing so, we will be able to, like you and your baby will not go through all this stress of sepsis, anemia, low birth weight. Your because you deliver the baby preterm, that's before term, the baby will probably have low birth weight, because your baby is not, when you need like 1 year, he or she wasn't up to term. Yeah, so there is a need for us to practice proper hygiene when you go to the toilet. This is not even for pregnant women, it's for all of us. When you go to the washroom, to the toilet, and then you are cleaning, don't be cleaning from back to front. You'll be introducing infections from your back to the front. I mean, after easing, you would need to wipe from front to back. Again, you wipe from front to back, so that you will not introduce the infections from the toilet or any other thing, and then bring it back to your vagina. No, we are avoiding all those things. Okay. Our next topic is resource incompatibility. I know that when we visit the antenatal clinic, we are being asked to do some labs, take some scans, and all those things. The reason that we do all of those things is to detect either abnormality or to see if you are compatible with your partner. So resource incompatibility, what happens is that when a woman's, so we all know our blood group, I'm sure most of us, hello, please, can you all hear me? Can I proceed?
Yes.
All right. With the resource incompatibility, what happens is that we all have our blood. You could be blood B, you could be B positive, could be O positive, A positive. I'm sure we have even no idea, or like a slight idea of what it is, and you might know ours. If you don't know yours, you should go check it. If a mother, so you will see that there's a diagram. I don't know if you can see it. I'm really sorry if it's appearing smaller. You see that there is a diagram. If you have a blood group and then that's negative. Let's say A negative or B negative or O negative, and you are the woman, and then you marry, and then your partner has a resource factor of maybe, okay, let's do it this way. I'm blood group B negative, and then my husband is A positive, and then we get pregnant. Both of us, we get pregnant. I mean, he's included. And then the babies can decide to choose Amy. The baby doesn't pick my blood, and then goes for the father's either negative or positive. So the father is positive, I'm negative. The baby doesn't pick mine, which is negative, and then goes for the father's one, which is positive. And then now I am negative, and then I have positive inside me. There is something called sensitization. The baby's blood has a way of mixing with my blood during vaginal delivery. It could be tear. Maybe during delivery there was a tear or episiotomy where the baby's head, maybe it's bigger, and then we would have to cut parts like your perineal part so that there will be excess room for a baby to come out. The baby's blood can mix with the mother's blood and then develop a sensitization. So when you look here, you will see that the man is positive and then the woman is negative, and the baby inside is negative. So after giving birth, there is a sensitization. So whenever after that pregnancy, any pregnancy that the mother has, it has a way of either terminating or she's getting miscarriages. This is because your antigens have developed an antibodies, and then it wants to fight these. It sees it as a foreign body. Yeah. So with this one, we are not saying that because you are negative and then your partner is positive, go and break up so that you know as you don't have a complication like that. So no, that's why there is education like this. You can let your healthcare provider know, or during antenatal care, they are going to know themselves, and then inquire about your partner's own. So if you are negative, they are going to inquire. If your partner is positive, you'll be given a medication called Rogam. What it does is that it will prevent this sensitization from happening, right? So that you can give birth to your subsequent birth. There will be no fighting of your baby as a foreign body, and then it's resulting as miscarriage. I don't know if you get it. Yeah. I've tried to summarize every single thing here so that we won't have to go through all of them. So that's what resource incompatibility is. And then it happens only when the mother is negative. If you are positive and then your husband is negative, it doesn't apply to you. Right, okay. So we move on to stillbirth. With stillbirth, that's when you deliver, and then you realize that your baby has either died in your womb or fresh after delivery. Sometimes you realize that after all these, you've taken good care of yourself, you've adhered to all these things, you've been going for antenatal care, you have been taking your medications, you've adhered to proper hygiene and all those things, but then you go to deliver and then you lose your baby. This complication, it could be either when you were delivering the baby, there was cord around neck, or there could be that there was a problem from the placenta, or idiopathic. Most conditions, we don't even know how it happens, and that's why we call it idiopathic. We don't know how it happens. You've adhered to all these things, but then sometimes we listen to the child's heartbeat and then it's not responding. We listen to the child has heartbeat and it's not responding. Then we check for fundal height. So one thing about pregnancy is that as your weeks progresses, your fundal height, which is how your tummy becomes bigger, it should be closer to your weeks. So let me just give you this assignment. I know there are pregnant women among us, or people that have already delivered. Your maternal book, you realize that whenever you go to the hospital, they use this measuring tape, the one the tailors use to measure your length and then they will use it to measure your fundus. Yeah. Whenever you are in week, any week that you are, maybe let's say you're in 24 weeks, you realize that your fundal height is either plus or minus 1 of that 24 weeks. It should be corresponding to that week. So maybe you are 25 week. You could ask I advise anything your healthcare provider does for you, either your midwife, your obstetrician, doctor, ask the person. It doesn't mean you're not polite, or it doesn't mean you know you're right, or like you can just ask them, and then they'll be willing to tell you. Yeah. You realize that the week that you are in, your baby's height, it's corresponding to that week. So if you are 24 weeks, you realize that your fundal height is either 23 or 24 or 25. I said earlier that it should be plus or minus 1, or it should be at the same figure, which means whenever it's like that, it means it's growing. Whenever you are, let's say 24 weeks, and then we check your fundal height and then it's 20, there's a need for us to pay attention to, because there could be that there is fetal growth restriction. Your baby is not growing, or there might be something happening. Yeah. So with stillbirth, you would check for all these. You will not hear any fetal heart rates. You will not hear any you will not hear any you will not feel any fetal kicks, or even when we check for the fundal height, you realize that it has decreased. It's not the same. It's not even plus or minus 1, or even plus or minus 2. Yeah. And then when this happens, what we can do is that we can either go for cesarean section and then bring the baby out, so that you will also not be affected. I mean, the whole of all these complications that I've said earlier is that it will not result in either maternal birth or child death, right? So that both mother and baby will be fine. But in a case where there's a complication for the baby, and then it has a way of affecting the mother, we would have to make sure mother is alive, or we have to make sure baby is alive, and it's all in your court. We are praying that it shouldn't happen, but it's also a complication that happens in pregnancy. And then I know that we are all, like, at this era, we all go to the hospital, and then we do not go to these traditional birth attendants and all that to attend to us. We do go to the hospital, because you could do all these things, and then you are in labor, and then you visit a traditional skilled attendant, and then the person ends up doing something wrong, or maybe using a sharp tool that could infect your baby, because they may not sterilize it, right? And then it could result in baby dying. I'm sure you, as a woman, you would have, I don't know how to put it, but then you will not do that, because you've gone through all these 9 months not to go to some of these people, but attend to the hospital for you to be checked. Yeah. So the whole goal of all for these complications is as knowing how to manage this and how to prevent it. Some of them can be prevented, like the urinary tract infection, by drinking enough water and then practicing personal hygiene and all that. Then there are others that cannot be prevented. Some of them are the placenta abruption and then the placenta previa. With the rhesus incompatibility, like I said, if you get to know your rhesus, your blood group, and then your husband's own, and you realize that it's incompatible, you can let your healthcare provider know. You'll be given the medication, and everything will be sorted out. So let us try and then adhere to all of these things, especially going to the antenatal clinics. Please do not stop. Do not stop. I mean, it's every month, right? So you can be going every month, and then nothing should stop you from going. Sometimes I do get complaints at the hospital. They'll be like, "Oh, I traveled. I went to visit my grandmother at this place, so I couldn't go." You could take your card. That maternal book that you have with you, it's like a passport. That green and red book, you could take it anywhere. If you're in Accra and then you travel to the north, and then you take it along, and then it's time for your antenatal visit. When you take it there, that's why medicine and this everything about medicine is about continuity of care. When they look at the information given, they will realize that, oh, okay, you are at this week, and then maybe you will need even your Rogam medication that you were given, you will need to continue there. When they look at whatever is in the book, they will understand and then continue your care there. When you return back to where you are, you can continue with it. So let us not be absenting ourselves from antenatal visits and all of like these counseling, and then webinars like this. Do take advantage of it, because it's really, really, really helps. Yeah. And then with our healthy lifestyle choices, let us practice. I cannot stop emphasizing on personal hygiene, because infections can cause a whole lot of things. Like it can even cause preterm labor. We know how if you get some after your menstruation, when you're not getting pregnant, that's what I'm talking about. After your menstruation, you realize that there is this itchiness and all that. You know how this uncomfortable it is, and then you being pregnant and then catching an infection. We would not want that to happen. So let us adhere to all of these, and when we do this, it will help us have a smooth, free, and then drama-free pregnancy. At this point, I will end here, and then if anyone has any question, can bring it up. Thank you very much. I'm done. Hello.
Hi.
Please, I'm asking if there is any question, there is any contribution, is there anything you didn't understand? You want to bring it up so that we talk about it? Or you could also type it in the chat box if you don't want to maybe talk. You could chat it in the box, and then we will respond.
Hello.
Hello.
Yeah, I joined a bit late.
Okay.
My line wasn't that stable, but
Oh, sorry.
I have something, a clarification to make concerning the fundal height, the measurement.
Okay, sure.
Mostly, is it plus or minus 2, or is plus or minus 1?
Okay. I did say that it should be either plus or minus 1, or it should be the same as your week of gestation. Yes, please. That's what I said. Why you had plus 2?
Well, I know of plus 2, plus or minus 2.
Oh, okay.
But a lot of changes as we move on. A lot of changes take place.
Okay. Yeah, that's true.
Yeah, that's why I just wanted to clarify. I know of plus or minus 2.
Oh, okay.
So let's take it that the person is 24 weeks of gestation.
Okay.
If you measure and the fundal height or the size of the womb is like 22.
Okay.
I think the person is still within the range. Or if you measure and the person is like 26, it's still within the range.
Okay.
Well, that's
Okay,
what
so
I know, but I don't know. As I
I
said,
think
maybe
I said something
you
about
know
the amniotic
this
fluid,
particular
right?
forum
And I made
is a
mention of
platform for learning,
oligohydramnios.
and there are a lot of
There's also
changes that are taking place
a
every
condition
day.
called
So that's what
polyhydramnios,
I just wanted to
and
clarify.
it happens when there's amniotic fluid around the baby. It's excess. So it could be that's fine, the baby is okay, right? But then the amniotic fluid, because it's plenty, it's contributing to the length or the height of its hair. It could also be a factor. Yes, please. I don't know if I've answered your question. So it doesn't mean that the baby is not growing. It is, but then there is a condition surrounding it, and then that's why we are getting that figure. Yeah. But you could also be right. Yeah, like you said, there are changes, and then we keep learning every day. So yeah.
Okay, good. So there's a question on the chat. So please, what trimester is the OGTT done, and is it always compulsory for a pregnant woman to do it? So if you can answer that question.
Please, can you give me the full meaning of the OGTT, Miss Joanna? Waiting. Let me go to Big Mommy. I'm sure when she writes it down, then I'll attend to it. Mommy, is it Big Mommy's asking? Okay.
So maybe you can go to the second question whilst probably
Okay.
wait.
Okay.
Have we seen the second question?
Yeah, I have. Okay, so with the resource factor, how is it diagnosed? Okay, sure. I said earlier that if you have, I'm sure you know of your blood group, right? It could be O positive or O negative, and then whenever the woman, it could be any of the blood. Whenever the woman's own comes as negative, so it could be O negative, B negative, AB negative. What are some of it? A negative, and then your partner is positive. Then you will need to alert us so that we give a medication so that you will not during delivery, and then there is mix up of blood. It will not create a sensitization in your body, right? So how it happens, you're asking of how it happens. It happens when the woman has a negative blood group. It could be any of the blood groups, and then the husband also has positive. If the woman's one is positive and then the husband is negative, it doesn't affect it, right? It's believed that the blood groups with negatives have the purest blood. That's what they are saying. So if there is positive introduced into the negative, that means it's more like you are bringing impurities into the blood. But then if it's the other way around, and the woman is positive and then the man is negative, and the negative is coming to the positive, because we assume that the negative is pure, and then the positive has already been, let's use the word impure. I'm not saying it is, but then I'm trying to make a scenario. The negative comes, it's like a clean water and a dirty water, because if the dirty water is already dirty and then the clean water comes in, nothing happens to the dirty water, right? But if it's the other way around, and then there's a clean water and then the dirty water comes into it, now it's alarmed, and then we get alarmed with it that it could affect the baby. So what happens is that after the man's positive has been introduced into the woman,
Yeah, hello. Hello, Mabel. Yeah, hello. Can you all hear me, please?
Yes,
Yeah,
please, you can be heard.
yeah.
Yes, please.
Okay. Maybe I am around. I don't know whether Mabel is off the line, but in case anybody have any question, you can still ask. We still have some doctors on the platform. I know midwife Aju is on the platform, right? Comfort. Are you on the platform?
Hello, yes, please, I'm on.
Okay, so can you, I think Mabel is off. So if you can kindly answer the first question concerning the OGTT. I think it's a medical, one of the tests that you normally do. The person wanted to find out whether it's, I think, necessary for you to do that test.
Okay, so OGTT is oral glucose tolerance test. Mostly it's done within 24 weeks, 26 weeks. And basically, they will ask you questions about your history. Okay, we want to know the family history. And is she back? Okay.
Yeah, hello, please unmute yourself. So I was trying to mute somebody and unfortunately I did for you. So kindly unmute yourself and continue.
Okay, so like I was saying, OGTT is done within 24 weeks, 26 weeks. And I said they will take the family history. Okay, actually, it's supposed to be done by every pregnant woman, but some hospitals, they let people who have family history of diabetes go through that test. So they tell you not to eat before you come. When you come, they do the fasting blood sugar. Then 2 hours later, I think no, after the fasting blood sugar, they give you glucose. Okay. After giving you the glucose, then 2 hours later, they check your sugar again to see what the results will be like. So that's what they use to make their conclusion to see if you are diabetic or you have a risk of having gestational diabetes. So that's that.
Very much. Winfred, I can see your hand. I don't know whether I want to ask any question.
Yes,
Winfred
please.
watching. Do you have any question?
Yes, please. Can
Okay.
I be heard?
Yes.
Can I
So
be
go
heard,
ahead.
please?
Yes, please. So go
Okay.
ahead.
All right. I'm also a midwife and I'm web now. I think there was a question that was asked on the founder height measurement during the antenatal period. And I wanted to give an answer to that question aside from what Mabel answered earlier. According to the American Association of Obstetricians and Gynecologists, we are expecting an increase in founder height right from the second trimester upwards. So during the second trimester, I'm looking for a height between ±2 in the second trimester. And then in the third trimester, a plus or a -3. So it is not fixed. As the gestational age moves higher, your founder height measurement disparity also increases. But we expect that during the second trimester, the difference should be ±2. And then during the third trimester, it should be ±3. That is for the founder height and not ±1. It is either ±2 or +or-3. That is for that. And then there was another question on the oral glucose test. I think our sister Ajo has done that. And then there's a test that are normally done to be able to diagnose gestational diabetes in pregnancy. So it's a diagnostic test. If we screen you based on your history and then we think you have a risk factor for getting diabetes, either pre-gestational or gestational, we want to be able to diagnose it, whether it was an overt DM or a gestational diabetes. So we usually do it during 24 to 28 weeks when a glucose sensitivity is high. Then we do this test to be able to screen whether you really have diabetes or not, so that we can be able to institute appropriate interventions and help you throughout the pregnancy safely for you and then your baby. So it's basically a diagnostic test we do for all pregnant women. Thank you.
Okay, thank you.
All right. Thank you. Okay, Mabel, you are back. Okay, so in
Yeah.
case anybody have any question, you can still ask. We have
Okay.
some few minutes for us to leave. Let me see. I think there are some questions. Maybe can you see any question on the chat?
No. Is there any?
I'm
I'm
trying.
only seeing pixels.
Okay, so if there's no question, can you give your final remarks? Then I can take over. Hello, maybe I'm asking whether if there's no question, can you take your final remarks? Then I'll take over.
Okay. So, I believe all that has been said, at least if not anything, you have a take home, something to take home. And then let us continue to educate ourselves. I mean, for today, I've realized that okay, it's not +1 for fundal height, but then +2, right? So let's just keep learning. Here, we shouldn't stop learning. And then if there is anything that you see online, and then you have any questions, you could, and if you have any healthcare provider you have a connection with, or then you could let the person help you out. We shouldn't stop learning, and then when we seek information too, we should try and dig deeper. Yeah. Thank you all for joining. Yeah.
Okay, thank you very much, Mabel, for the wonderful presentation. We are so grateful. You did extremely well. I think the presentation was very extensive, and we've really enjoyed it. And probably, I know some people want to get a presentation, so you can share with me if it is possible. Then I can
Sure.
share it on the page. Yeah. So, God willing, next week we shall also have another presentation from another midwife who is based in Kolebu. It's very popular, and so I'll be sharing more details on the page, on the WhatsApp page, and also on our Facebook pages. So those who are not on our WhatsApp page, I've shared the link on the chat. So kindly go to the chat and join our WhatsApp page if you are not part of it. So thank you very much. Thanks a lot. The other midwife that also contributed, midwife Ajo, will be Ajo. The name is Ajo, right? I know of the comfort. I don't know whether I'm pronouncing it well. Midwife Ajo. Okay, maybe it's off. So midwife Comfort, who is based in Kolebu, will be the next presenter. Going next week, the same time at 4 p.m. through Zoom. Thank you very much, Dr. Ennis, for the contribution, and of course, I think one midwife, Winfred, also did a contribution. So thank you very much. So God willing, we'll meet again next week for another presentation. Thank you all. Bye.
Bye.
So guys can also join.
And people want I don't qualify. Transfer money down. Transfer money down.